in this episode.
The basic point of cheek retraction is to achieve adequate but minimal cheek retraction. Why is that? Only a couple of shots like maximum intercuspation position shot or anterior guidance shot. This is not a great cheek retractor but once you put it inside the patient's mouth, you get amazing cheek retraction, and it is a self-retaining one, so it's ideal for the main aim is to just keep the frenum away, and that's about all I require. The frontal shot is easier in anterior third cases, but the lateral shot, in which you're perpendicular to the lateral incisor, it's a little tough. So if you think that the cheek retractors are very close to the marginal gingiva during the anterior aesthetic shots, just the tongue actually covers the occlusal surface of the tooth. So in this particular case, you're listening to the Dental Photography School podcast, where I'll be sharing practical tips on clinical and general photography. I'm Dr. Mayur Dauda, and I've been coaching dentists and dermatologists on clinical photography since 2013. If you don't want to miss out on any action, make sure to subscribe to my show because I release an episode every Saturday morning. In this episode, I am going to be speaking about cheek retraction and cheek retractors. That's one of the most important things for dental photography, and unless and until you do good cheek retraction, you are not going to get a desirable result in your pictures. So let's dive into the topic. Alright, so the most important tip that I could give all my listeners is do not just keep one single set of cheek retractors for all your needs. We need different cheek retractors for different purposes. So let us have a look at what cheek retractor is supposed to be used in which situation. Let's start off with the most commonly used cheek retractor. It is called as the C-shaped cheek retractor. And the actual retraction units are C in shape. They could be available in two types. One is a self-retaining type, and one is with a handle that the patient can hold it by himself. A very popular one is the one with self-retraction as well as handle. So it has both. So make sure that if you want to use them, you're using it for only a couple of shots like maximum intercuspation position shot or anterior guidance shot. This is not a great cheek retractor for any other kind of documentation. In general, the best rule for good cheek retractors is let them be transparent, or nowadays even black cheek retractors are very popular. So this is never going to change with any design of cheek retractor. Just keep it constant. Do not invest on yellow, red or blue colored cheek retractors or whatever color that you like, because sometimes it's seen in the pictures and it looks really shabby. Let's move on to what cheek retractors are ideal for molar relationships and canine guidance. So in this particular image, we're going to be asking the patient to look on one side, and we're going to be recording from the canine of our side. The retraction in this case has to be distal retraction rather than upwards and lower retraction. So we need a deeper notched cheek retractor, and we have something called as a Y-shaped cheek retractor for this purpose, which has a very deep notch and which is very obvious as compared to a C-shaped cheek retractor. This is not a self-retaining cheek retractor, and somebody has to hold it. So usually I ask the patient to hold it. If the patient does not hold it, then my staff holds it. And if I'm still not happy, then I hold it myself and then do the retraction. So for molar relationships and canine guidance, when we are recording only one side of the patient and asking the patient to look on one side, we have to use something called as a V-shape or a Y-shape cheek retractor. For most of the other things, we use a quadrant cheek retractor or a sectional cheek retractor. The basic point of cheek retraction is to achieve adequate but minimal cheek retraction. Why is that? Because we want the patient to open as much as possible, and if we put big cheek retractors or do excessive cheek retraction or lip retraction for that particular case, the patient is going to be finding it really difficult to open wide. So we're going to be compromising with space to put a contrastor or mirror inside the patient's mouth. So the cheek retraction has to be minimal but absolutely adequate. So that's a very, very fine balance that has to happen between these two. So the reason why we use quadrant or sectional cheek retractors is exactly this. If you want to record a quadrant, for example, if I just want to record 1, 6, 1, 7, 1, 8, or if I just want to record 3, 4, 3, 5, 3, 6, there is no point in putting a C-shaped cheek retractor or a V-shaped cheek retractor inside the patient's mouth, which is going to retract both the upper and the lower lips and the cheeks. Instead, if I'm just recording 1, 5, 1, 6, 1, 7, 1, 8, I'll just retract the upper lip of the right side. So that's possible only with a quadrant cheek retractor or a sectional cheek retractor. If you try to put a C-shaped cheek retractor, in this case, what it does is it's going to retract both the upper and the lower lips and a lot of cheeks, and it might be very difficult for the patient to give you a good mouth opening. So just keep in mind that try to retract as less as possible to get your work done. So quadrant retractors are paired. So the first quadrant can be used for the third quadrant, and the second quadrant cheek retractor can be used for the fourth quadrant cheek retractor. So most of the cheek retractors are paired. For example, the C-shaped cheek retractor, which gives us more upper lower lip retraction, which it's a paired cheek retractor. The quadrant retractors are paired retractors, but the V-shaped cheek retractor is a single retractor. It does not come as a pair. However, obviously, if you are very comfortable using it, you can buy an extra set and always keep it, because that's really good for some of the maximum intercuspation shots as well. So these are the cheek retractors that I frequently use. They are transparent most of the time, but a lot of other cheek retractors are popular as well. So what are they? There is metallic cheek retractor. It's like a very thick gauge wire. You got to squeeze it and then put it inside the patient's mouth. So it looks like a U-shaped cheek retractor with bends in between. It looks a little weird. When you look at it for the first time, you might not be able to guess that it's a cheek retractor, but it's a very heavy gauge and it requires a lot of effort to put it inside the patient's mouth. But once you put it inside the patient's mouth, you get amazing cheek retraction, and it is a self-retaining one, so it's ideal for MIP shots or maximum intercuspation shots or anterior guidance or anything in which you want to record both the upper as well as the lower arch together from the frontal view. So there is one more cheek retractor that's popular. It looks like a T shape, but an inverted T shape. You can call it like a U with a stick below it. This is also a metallic wired cheek retractor. It's actually not a cheek retractor. I don't think I can call it a cheek retractor. It's mainly used for maxillary and mandibular full arch occlusal images, and it goes from the anterior to the posterior. You have to slide it anterior to the posterior direction, and you've got to hold on the handle, which is a very long handle, and just reflect the lips upwards or downwards depending upon if you are recording the maxillary or the mandibular full arch occlusal image respectively. These are great cheek retractors for full arch occlusal images, but some of my patients found it really difficult to get accustomed to, especially patients which had a lower frenum attachment. In the sense, a patient who had a very small frenum or their frenum attachment was quite close to the marginal gingiva, they found these cheek retractors very, very painful. So I had to stop using it for most of my patients. So if I want to record a full arch maxillary or a mandibular full arch image, I just use 2 quadrant cheek retractors, and my main intention is to still retract the frenum away from the teeth. So these are the different cheek retractors that are available in the market. If you know any other cheek retractor, I'd be really happy to listen from you. Just put it in the comments, just write it down in the comments. What cheek retractors do you like to use? And I'd be really happy to see them as well. Now let's talk about the technique of cheek retraction. My main technique and the one tip that I usually give to all my students is that when you are not ready with your camera still, do not do full cheek retraction, and that's a golden rule for me. So although I have placed the cheek retractors in place to start off with, my camera settings and all, everything is set, then I put the cheek retractors, but focusing is still remaining, right? How do we focus in dental photography? We go really close to the patient and then start moving behind, and at one particular point of time, if my subject is sharp, I go ahead and take the shot. So till the time I get a little bit of sharpness of my subject, I do not do complete retraction. But as soon as my subject becomes sharp, I give it a good amount of pull, or my subject or my assistants give it a good pull, thereby achieving good retraction. So I tell my staff that retract only when I ask you to retract fully. Till that time, just hold the cheek retractor in place and don't do anything. What this is going to do is this is going to reduce the inconvenience that's caused to the patient, because the patient knows that you're just holding it for most of the times, and only when the subject is sharp you're going to do the retraction. So it's very quick and very comfortable for the patient, and it's one great tip that you can start applying from right now itself immediately. The other tip which I've already shared is to as minimum retraction as possible, but it should be adequate retraction. So it should not be under retraction and it should not be over retraction. It should just be perfect. Now this thing is going to only come with time, so you require a steep learning curve for this, but the retraction should be just adequate. That's all. For quadrant images, for quadrant images, in the sense when I'm just recording the first quadrant or the fourth quadrant, I just do a little bit of holding of the lips. I actually do not go ahead and retract. I'm just separating the mucosa from a little away from the teeth. That's how I record my quadrant images. I actually do not pull the lips or the cheeks away, because that again reduces the amount of mouth opening that the patient could have given me. In other words, I would say I just keep the lips a little away from the buccal aspect of the teeth that I want to record. So that's about the quadrant images. For maximum intercuspation shot, I have seen that most of the patients, or sometimes even the dentists, they do a distal retraction. This is not a great way to retract for MIP shots or anterior guidance. The best way for retraction in this case is forwards and laterally. So there'll be a lot of empty space. There'll be a lot of hollow empty space mesial to the cheek mucosa, and you'll have a good amount of separation of the teeth from the mucosa, and that's completely fine. But when you do distal retraction, all the mucosa is going to hit the buccal surfaces of your molars, which is going to look really bad in the pictures. So just remember, for maximum intercuspation shots and anterior guidance, you have to do forwards and lateral retraction. For molar relationship shots and canine guidance, you have to do distal retraction, which is probably one of the toughest forms of retraction, because you have to record almost the full 6 and a little bit of 7 at least. So a lot of distal retraction is required. Since a lot of distal retraction is required, it's not possible with the standard C-shaped cheek retractors. You have to shift to a V-shape or a Y-shaped cheek retractor. And then the technique remains the same. Just ready the camera, put your cheek retractor. If you want, you can put a contraster on the contralateral side and give and just hold the cheek retractor in place. Go with your camera and the lens close to the subject, and as you come behind using your macro lens, there'll be a particular time when the canine will be sharp. Go ahead and take the shot, but when you are taking the shot, you require to have a massive distal cheek retraction at that place. Usually I ask my staff to hold the patient's head at this particular moment when I'm going to retract heavily, because many times when I retract, the patient's head also moves along with cheek retraction, which is something that will prohibit me getting a good image. So one of my staff is actually holding the patient's head so that the patient's head does not move during molar relationship shots. This is again a great tip to be immediately put forward to work. For maxillary full arch occlusal images, I just do something called as frenal retraction. So my main intention in recording maxillary full arch occlusal images is not to be rigorously retracting too much, and the main aim is to just keep the frenum away, and that's about all I require. Usually that much is enough for recording a full arch maxillary occlusal image. Sometimes for anterior aesthetic shots, the rule remains the same. Just like the maxillary full arch occlusal image, you just need something called as frenal retraction. So just keep the frenum away from the subject and you're good to go. Keeping the quadrant cheek retractors for anterior aesthetic cases in proper position is really ideal. Keep it as close to the frenum and retract the frenum. That will be the gold standard for getting a good image. But many a times when the frontal shot is easier in anterior aesthetic cases, but the lateral shot, in which you're perpendicular to the lateral incisor, it's a little tough. So when the patient is looking on the left and right side, or if the dentist is moving on the left and right side, the cheek retractors do tend to come down. So if you think that the cheek retractors are very close to the marginal gingiva during the anterior aesthetic shots, it's probably because you put the contrastor inside the patient's mouth and the patient is opening it really wide. You can solve this problem by asking the patient to close a bit. So if the patient closes the mouth slightly, you will be able to get a good amount of apical retraction, which is a really nice rule to follow, and again can be immediately applied as well. Now coming to some of the most difficult situations where I find a retraction a little difficult is patients having macroglossia. Now, if I want to record a fourth quadrant or a third quadrant, so I usually use the sectional cheek retractors only. So first and third is same and second and fourth is same. But sometimes when I'm recording the fourth quadrant, after retracting the fourth quadrant lips, I do get to see the tooth in question very well during my preoperative shot when I still not put the rubber dam in place. The problem that happens in macroglossia cases is that the tongue actually covers the occlusal surface of the tooth. So in this particular case, I usually ask my staff to retract the tongue with a tongue depressor or a tongue retractor. But if you don't have it, you can also use a normal mouth mirror for retracting the tongue. It's hardly going to take around 3 to 5 seconds, but you have to see to it that you finish the shot in 3 to 5 seconds. So the patient has to open quite wide, and tongue retraction has to happen at the same time when you are retracting the cheeks, or the patient is holding the cheek retractors for you, because you're going to be holding the mirror for recording the quadrant image. So this is one instance when I use a mouth mirror or a tongue retractor apart from cheek retractors for recording the lower quadrants. Sometimes when I do not have access to a mouth mirror or a tongue retractor, I also use the buccal contraster by the magic box to retract the tongue and achieve the same result. One really good tip that my listeners would probably like it a lot is always ask your staff to have a mirror in their hand, but the suction should also be there at all the times, because you want the entire quadrant to be nice and dry when you are recording the pre-operative shot. Operative shots are really easy because the rubber dam is in place, so you don't have to do you don't have to do any kind of retraction. But during the pre-operative shot, you have to be really careful that everything is nice and clean. There's no excessive saliva, and your staff has held the suction very well. So this these were a couple of tips about cheek retractors. Just for you to know, all the cheek retractors that I spoke about today, that is the C-shaped cheek retractor, the V-shaped cheek retractor, the quadrant cheek retractors, are available and are a part of the magic box. You can buy them separately if you don't want to buy the full magic box as well. So the cheek retractors is a set of 5 cheek retractors. The C shape is a pair, the quadrant is a pair, but the V shape is a single cheek retractor. If you would like to buy it, just you can just mail it on info@dentalphotographyschool.in, or you can just WhatsApp on 8655225522. And if you're calling from outside India, don't forget to put the country code. So the number would be +91 8655225522. Hopefully you like this episode. If you have your own tips and tricks to share about cheek retractors or retraction, do not forget to mention in the comments below. I'll be looking forward to hear from you. Until we meet again, goodbye. That's all we have time for in this episode. If you are getting benefited from my tips, do show your love by leaving a rating and a review. For tutorials on photography, do check out my channel Dental Photography School on YouTube. To participate in contests and live events, join the Dental Photography School Facebook and Telegram group. You can follow me on Instagram as Mayur_EOS Maestro or Dental Photography School. I'll meet you next week. Till then, keep listening, keep sharing.